Welcome to the WION podcast, where we explore fascinating stories and ideas from various fields. In this episode, we uncover a life-saving discovery that scientists have created a spray-on powder that can stop bleeding in just 1 second, and it could transform emergency care in war zones and beyond. A research team at KAIST, which included an active duty army major, aims to develop a quicker and more dependable method to control bleeding instantly, a leading cause of death in emergencies. Their effort resulted in a next-generation powder-based hemostatic agent that can stop bleeding within a second when sprayed directly onto a wound, potentially saving lives on the battlefield. On December 29th, KAIST said a joint team led by Professor Steve Park of the Department of Materials Science and Engineering and Professor Sang-Yong John from the Department of Biological Sciences had developed a powder-based hemostatic agent which rapidly forms a strong hydrogel barrier. Once applied to an injured part of the body, it transforms in about 1 second, immediately sealing the injury. Developed with real battlefield conditions in mind, the technology benefits from the Army Major's direct involvement to ensure practical usability. The agent hardens instantly, even in extreme environments such as combat zones or disaster sites, and remains stable during storage, allowing rapid deployment in emergency care, according to a report in SciTech Daily. PhD candidate Q-Soon Park, who participated in the research, said, "The core of modern warfare is minimizing the loss of human life," and added, "I started the research with a sense of mission to save even one more soldier." He continued, "I hope this technology will be used as a life-saving technology in both national defense and private medical fields." A patch-type hemostatic product, often used as medicine to treat deep or irregular wounds because of its flat shape. It is also sensitive to heat and moisture, limiting its storage and use in demanding settings. To overcome these issues, the KAIST team came up with the hemostatic agent in the form of powder that can be applied to wounds of any shape and sizes, as well as deep or uneven. A single formulation can also be utilized in a wide range of injury types, which can improve flexibility in emergency care. The AGCL powder, which has been developed, possess a structure in combination of biocompatible natural materials that include alginate and gellan gum, which react with calcium for ultrafast gelation and physical sealing, as well as chitosan, which bonds with blood components to enhance chemical and biological hemostasis. It works in the body after reacting with cations such as calcium in the blood in order to turn into a gel state in 1 second, quickly sealing the wound. AGCL powder is made entirely from natural materials and is safe for use with blood, with tests showing a hemolysis rate below 3%, cell viability above 99%, and antibacterial effectiveness of 99.9%. In surgical liver injury trials, it significantly reduced blood loss and shortened the time needed to stop bleeding compared to existing commercial hemostatic agents. Liver function returned to normal within 2 weeks after surgery, and no signs of systemic toxicity were detected. While the technology was developed primarily for national defense applications, it holds strong promise for broader use in emergency medicine, including disaster response, developing regions, and underserved healthcare settings. The innovation is also seen as a notable example of defense-driven science successfully transitioning to civilian use, with applications ranging from battlefield emergency care to internal surgical bleeding control. Thanks for tuning into this incredible story. If this episode resonated with you, don't forget to hit the like and subscribe button for more captivating stories to come. Stay tuned.